Welcome to Pharmacology Case Studies. The topic is CNS Stimulants. All the reasons and answers will be written in the below in the link. Case study 1. A young male was brought to the emergency room by the police due to severe agitation. Psychiatric examination revealed that he had injected dextroamphetamine several times in the past few days. The last use was 10 hours prior. He was given an IM drug that sedated him and he fell asleep. Which drug was most likely used to counter this patient's symptoms of dextroamphetamine withdrawal? Trazodone, lorazepam, cocaine, hydroxyzine. Now you know trazodone has hypnotic properties but anxiolytic properties are inferior. Lorazepam is the drug of choice here. The correct option is B. The anxiolytic properties of lorazepam, that is benzodiazepine, helps in treating anxiety and agitation of amphetamine or cocaine abuse. Lorazepam has also hypnotic properties, whereas hydroxyzine is an antihistamine and is effective as hypnotic, but it is used sometimes to deal with anxiety if MSS is the problem. Next. A 10-year-old boy is sent to pediatric neurologist for an evaluation due to poor performance and inability to pay attention in school. He has also been fighting with other children. He is given a diagnosis of ADHD with impulsivity and irritability. Which is the most appropriate management for ADHD? Clonidine, mirtazapine, dextroamphetamine, haloperidol. Now, dextroamphetamine is the only stimulant drug that is approved for ADHD, and symptoms such as fighting in academic performance, they can now this option haloperidol, it will treat fighting symptom, that is hyperactivity, and hyperactivity can also be improved by clonidine, but they will not improve academic performance and the underlying problems discussed in this case study. So here the correct option is dextroamphetamine, option C. Next, a 10-year-old boy with ADHD has symptoms that are controlled with an oral psychostimulant. However, he and his family wish to avoid having to give a second dose of medication at school. They prefer an alternative treatment that can be administered in the morning and last the entire day. Which treatment option is best? Mixed amphetamine salts in immediate release oral tablet formulation, methylphenidate in transdermal delivery system, nicotine in a chewing gum formulation for buccal absorption, methylphenidate in immediate release pills. Here the correct option is B, methylphenidate in transdermal delivery system. So it will be once daily use and it will avoid midday using. Immediate release will require at least BID twice a day. Which of the following agents for ADHD is controlled substance? Schedule 2. Clonidine, atomoxetine, lisdexamphetamine, disipramine. Here only lisdexamphetamine is controlled substance. The other are used for ADHD but not controlled. So the option C is correct answer. Then amphetamines may be used in patients with which of the following conditions? Cardiovascular disease, hypertension, hypothyroidism, obesity. Here amphetamines are used in the management of obesity, but the patient should be closely monitored for the other conditions, contraindications and all. So the correct option is D, obesity. Which of the following agent is considered first line treatment for necrolepsy? Galantamine, atomoxetine, temazepam, modafinil. The correct answer is modafinil because this is the only drug that is approved for necrolepsy. Correct option is D. Next, which of the following is a common adverse effect of amphetamines? Bradycardia, somnolence, constipation and hypertension. Correct option is D, hypertension. That is the adverse effect that warrants caution, especially in an individual with risk factor for high BP. So amphetamine can cause tachycardia, not bradycardia, insomnia, not somnolence, and diarrhea, not constipation, and hypertension it causes. The correct answer is D. Which of the following CNS stimulants occur naturally and can be found in certain candies? Amphetamine, modafinil, caffeine, atomoxetine. Only caffeine is the drug which is naturally available and is also found in cocoa, chocolate, and many forms of tea, cold beverages, and it induces anxiety, insomnia, and even risk of seizures are increased. Correct option is C. A 35-year-old man is interested in quitting smoking. In previous quit attempts, he has tried nicotine gum, the nicotine patch, and the cold turkey method. He has been unsuccessful in each of these attempts and resumed smoking within 4 to 6 weeks, which may be useful to assist in his attempt to quit smoking. Varenicline, dextroamphetamine, lorazepam, methylphenidate. Varenicline is approved as adjunct therapy for management of nicotine dependence, and it will attenuate the withdrawal symptoms of smoking cessation as well through monitoring, and is needed for changes in psychiatric status, including suicidal ideation. And the rest, the use of dextroamphetamine, lorazepam, methylphenidate bring the risk of addiction to another substance with abuse potential. So the correct option is A, varenicline. Which of the following agents carries the lowest risk for addiction? Are modafinil, less dexamphetamine, dexmethylphenidate, varenicline. Option D, varenicline has the lowest risk and it is not controlled substance. The others are controlled substance and have the risk of dependence or abuse. The correct option is D. All the correct option and reasons are mentioned in the below link. Thank you.